So this is some big news for me. I finally got eye surgery. And I think this is a really cool story to share because as an eye doctor who's worn glasses and contacts most of his life, I've had a lot of people ask me, why don't I just get eye surgery or LASIK or something like that? But as we'll talk about today, I actually didn't get LASIK. I instead elected for what is called the EVO ICL surgery, which if you've never heard of before, stands for implantable Collamer lens surgery, which is a type of refractive surgery that has some unique features versus LASIK, which I think is really valuable to share and for people to know about, especially if you're somebody who has a high amount of nearsightedness or struggles with dry eye symptoms like myself. Now, to have this surgery, I actually got to collaborate with Star Surgical, the company behind the EVO ICL, and flew all the way out to Seattle, Washington to meet with Dr. Matthew Sharp from Sharp Vision, who happens to be a top award-winning eye surgeon who has done hundreds upon hundreds of these types of procedures. So in today's video, we're going to go over what is ICL surgery and how it works, plus I'll share my experience having the procedure, the recovery, and how amazingly sharp my vision is now and just the experience of seeing after the procedure. Plus, we'll talk a little bit about how ICL is different versus other forms of refractive surgery, such as LASIK. That way, if you ever do go into having a consult because you're interested in having refractive surgery yourself, you'll have a better understanding of what these options are, as well as what the experience may be like having ICL. But first, let's take a step back and go over why I decided to have eye surgery in the first place. Now, again, I've worn glasses and contacts since I was a little kid and never really loved the experience of looking through glasses and never really loved the feeling of them on my face or how I looked in them. And then contact lenses, while they gave me a lot of freedom, I often did experience a lot of dryness. Even as a little kid playing video games, my contacts would dry out. And then here in the eye clinic, sometimes I'll examine patients and my contacts would dry up and my vision would fluctuate and blur, and that's just something I didn't really want to deal with anymore. And I'm also concerned long term, if I'm having this dryness with contacts now, is this dryness perhaps going to get worse as I get older? And so those again are all the reasons that I finally decided, yes, I want to finally have refractive eye surgery. Let's do this. Now again, for this procedure, I flew all the way out to Seattle, Washington to meet with Dr. Matthew Sharp from Sharp Vision, as he has done hundreds upon hundreds of these exact procedures. And he was nice enough to sit down with us on camera and share from his own words how this procedure goes down. So, Dr. Sharp, thank you so much for being here. This is always incredible to have such a specialist like yourself being able to share their knowledge with everybody who watches the channel. But since you've gone through this so many times, and I think people would just love to hear in your own words, can you describe to us what is the EVO ICL and kind of how this procedure goes down?
Well, thank you, Dr. Allen. I'm just delighted to have the opportunity to talk to all your viewers about the ICL because a lot of people haven't heard about it, but ICL stands for implantable Collamer lens. The lens is a very thin Collamer, which is a mix of collagen. It comes in different diameters and different powers of nearsightedness, and then it also can correct astigmatism. And so what it does is, after we've taken all the measurements of the eye, the prescription amount, and measuring the anatomy of the eye, the procedure itself is about a 5 to 7 minute procedure where, with the eye totally numb, the patient's awake but sedated, so they're very relaxed. We put the lens inside the eye and right behind the iris, or the colored part of the eye, and then position it for the astigmatism at whatever angle we calculate, and that corrects their nearsightedness and astigmatism and allows people even from down to -3, which is a fairly low degree of nearsightedness, all the way up to -15. It is removable if we ever needed to, which is generally when they're 60 or 70 and need cataract surgery, and no dryness. And that's been one of the issues with LASIK, that there's very frequently some degree of dryness, and you just don't have that with the EVO because we're not changing the surface of the eye, the cornea. We're just putting it inside the eye. It doesn't require any maintenance, cleaning. It just stays in. And these have been in people's eyes in the same material, slightly different form, for over 30 years now.
But now the question is, why did I choose ICL surgery versus having LASIK eye surgery? Because I technically qualified for both procedures. Now, I wanted to go with ICL for really 3 reasons. First of which has to do with dryness again, because LASIK eye surgery, a common complication of that is dry eye. And being that I've already suffered with dry eye, I really don't want to make that worse. And ICL surgery, clinical studies have shown that it's not caused or worsened dry eye. So that's probably my number one. The second reason I elected for ICL is because it is reversible, where LASIK eye surgery, which is a fantastic procedure with a great track record, but when that procedure is done, it permanently removes tissue from the surface of your eye, which will never grow back. But with ICL, because it's an implanted lens, a surgeon could go into my eye at a later time and remove that lens, whether it's because my eye changed in some way, or if I need another procedure in 30, 40 years, like cataract surgery, for example, again, a surgeon could go in and remove it. And then the third reason has to do with clarity of my vision. With ICL, the lens is implanted deeper inside of the eye, closer to what we refer to as the nodal point, which is kind of the theoretical center of the eye. And correction at that point can reduce higher order aberrations, essentially reducing glare that people would experience. And they've shown that correction at that point can reduce glare compared to what people experience with glasses and contacts. So if I have a chance to see even better than what I've experienced with glasses and contacts in the past, yeah, sign me up. So here is what my experience was like having the procedure from my perspective. First, I'll admit that yes, I was a bit nervous to go in to have this procedure, even though I've had patients and friends who've had it, and I know the statistics, I know the success rate. I still, I think just having any eye surgery, if you've never had the experience before, it's a little nerve-wracking. So I was a bit nervous going in, but the day of about, the hour before they do pre-op, they put not only dilation drops in to make your pupils really big, but then they give you numbing drops on the eyes to make you comfortable. And then they did also give me some medication to help calm my nerves, which I think really did help me just relax and made the whole thing go a lot smoother. When they laid me down for this procedure, I was basically on my back looking up at a bunch of surgical lights. And of course, I didn't have contact lenses in or glasses on at the time, so everything was a bit out of focus and blurry. And they did numb my eyes, so I didn't feel anything, but during that procedure, I noticed that all of the lights were sort of bending and warping, kind of like a kaleidoscope in a way. And that's because when they put the lens in my eye, it had to unfold and you would see the light passing through and again would kind of look bent and warped. I also have astigmatism in both eyes, and so they had to put a lens in, the ICL, for astigmatism. And so Dr. Sharp had to rotate that lens to get it in just in the right place. And during that time, again, I also saw those lights sort of bend and warp. Now, for my procedure, it felt like it went by super fast. I think it technically only took like 6 minutes per eye, I think, but it didn't even feel like that. It felt more like 2 or 3 minutes. It went by just super quickly. And then just sitting up from the procedure, I remember, again, your pupils, if you've ever had your eyes dilated before, everything is always a little bit off, but I could tell immediately that my vision was already much better and in focus. Now, after the procedure, I then was given a nice goodie bag that had some eye drop medications that I was to use over the next several weeks just to help prevent infection, calm down any inflammation after the surgery. But immediately afterward, I was really tired. So I just went back to the hotel, took a long nap, and the next day, I went back in to have my first post-op appointment with Dr. Sharp so that they could not only check my vision, but check my eye pressures and make sure the implant was in the correct position. And not only was everything going fantastic, but my vision, within 24 hours of the procedure, not only was I seeing 20/20, I actually saw 20/15, which is even better than 20/20, and which I think is just remarkable because it's within 24 hours of an eye surgery, and there's always a little bit of inflammation after a surgery, so to see that sharply afterward was just incredible. And since then, it's about a month out now. I've gone through all of the post-operative eye drops. It's calmed down all of the inflammation on the eye, and my experience is just, I will say it's amazing. I don't want to oversell it, of course, but just my vision is not only the sharpest it has ever been in my life. It's tough to describe because it's not just seeing 20/15 on the letter chart in the eye clinic. It's the fact that everywhere I look, my vision is just super crisp. It is very fine. I see so much more details in everything I'm seeing, especially far away. Several times a week, either to myself or to one of my friends, I usually have to stop and just be like, wow, like I just see so much better than I've ever seen before. It's a really cool experience. And on top of that, another big thing for me is just my eyes are comfortable. My eyes are not as dry as they were, because before I had worn contacts most of the time, and anybody who's worn contacts, usually toward the end of the day, they do start to dry out a little bit, and you can feel that and your vision can fluctuate. And so again, for me, not having that feeling has been great. And probably the only issue I've ran into is that some nights I have to question, did I forget to take out my contact lenses? Because I've worn contacts for, almost 20 some years now. The only thing of my experience that I'll add here, and I know I'm not the only person who sometimes has this experience with this type of an implant, is I do see some halos in my vision on occasion. Especially early on, right after the procedure, I was a little bit more aware of them. But basically, if I'm walking down a street and I see like a street lamp, if I'm looking kind of just off center in just the right place, I can see these sort of rings of light in the periphery of my vision. And those are caused by the porthole in the implant, and if light just hits right at the certain edge, then you can sort of see these halos appear. I do feel like I noticed them a lot more right after the procedure, and over the course of the month, I've either adapted to them or as the eyes healed, I just don't see them as often. And even when I do see them, I'll admit I'm just much of an eye nerd. They don't really bother me. If anything, I find them a little bit entertaining and somewhat pretty at times. But I've even talked to some of my other colleagues, other eye doctors who've had this procedure, and they all said that, yeah, they saw them too, especially early on, but after several months of healing, they almost never see them anymore. But I think it's important to mention that just because if you ever go through this procedure yourself, you may see these and may wonder what are these little like halo things I'm seeing. But again, they usually do get better. Now these, of course, are just my personal experiences, and results may vary for individuals and may not be guaranteed. So always really important, if you're considering having an eye surgery like this, always consult with a local healthcare professional for proper medical guidance of what's best for you and your eyes and your vision. And if you're interested in learning more about the ICL surgery specifically, then check out discovericl.com for more safety information. But overall, again, it was just an excellent experience, right? Dr. Sharp and his whole team were amazing, and my vision afterward has just been incredible. But I think even for myself, like as a doctor, I think I've learned a lot through this experience, because now I know more of what my patients who I refer for this procedure, what they're going to like physically and mentally go through prepping for this surgery, but also like what kind of experiences, what kind of a life-changing event it can be for somebody visually, like how big of a change this can be. But from here, I'd love to pass this off to you. Do you have any questions about the ICL procedure? Do you have any questions about my personal experience? I'd love to answer those questions, so please drop them in the comments section. Otherwise, huge shout out and thank you to Dr. Sharp from Sharp Vision and Star Surgical for helping make this video possible. And thank you to you for giving me a moment to share my amazing experience. And from there, keep an eye on it, and hope you have a great day.